What causes recurrent urinary infections despite prevention methods? Have you ever wondered why some people keep getting urinary infections even after trying to prevent them? Recurrent urinary tract infections, often defined as 3 or more infections in a year or 2 or more within 6 months, can be frustrating and painful. Several factors contribute to these persistent infections, and understanding them can help in managing the issue effectively. First, structural problems in the urinary system can play a significant role. Conditions like bladder outlet obstruction or incomplete bladder emptying can create an environment where bacteria thrive. For instance, an enlarged prostate can slow urine flow, allowing bacteria to multiply. Other anatomical issues, whether congenital or acquired, can also hinder normal urine flow, leading to repeated infections. Another important factor is biofilm formation. Certain bacteria can create a protective layer on the bladder lining or urinary catheters. This biofilm shields them from antibiotics and the body's immune system, allowing these bacteria to persist despite treatment efforts. Metabolic and systemic conditions, such as diabetes and obesity, can also increase the risk of recurrent urinary infections. These conditions can weaken the immune system and alter the natural defenses of the urinary tract. Additionally, urinary stones can harbor bacteria and promote inflammation, further complicating the situation. Sometimes, the initial treatment of an infection may not be sufficient. If the chosen antibiotic is not effective or if the treatment duration is too short, the infection may not be fully eradicated. Antibiotic resistance can also be a factor, making it harder to clear the infection completely. Behavioral and hygiene practices are also crucial. While drinking plenty of fluids and maintaining good hygiene can help reduce the risk of infections, they may not be enough for everyone. Some individuals may have ongoing risk factors that these methods do not fully address. For postmenopausal women, hormonal changes can lead to alterations in vaginal flora. Decreased estrogen levels can reduce protective bacteria, increasing susceptibility to infections. In such cases, vaginal estrogen therapy may help restore balance and reduce the risk of recurrent infections. Lastly, individual differences in immune response can make some people more prone to infections, regardless of preventive measures. Each person's body reacts differently, and understanding this variability is key to managing urinary health. Recurrent urinary infections not only cause discomfort but can also lead to chronic inflammation, increasing the risk of bladder tissue damage and potentially bladder cancer over time. Therefore, it is essential to manage recurrent infections effectively for both immediate relief and long-term health. If you are experiencing recurrent urinary infections, it is important to consult with a healthcare professional. They can help identify any underlying issues and tailor a prevention and treatment plan that works for you.